Hi friends, this is Dr. Aparna and welcome back to my channel. In this lecture, we are going to study about the developmental disturbances in the number of teeth. The developmental disorders in the number of teeth can be grouped into four categories. They are anodontia, supernumerary teeth, pre-deciduous dentition, and post-permanent dentition. Let's begin with anodontia. We can split the term anodontia into two parts, ana and dontia. Ana means absence. Dontia means teeth. So, as the name suggests, anodontia means absence of teeth. That means it is a congenital absence of teeth. It is associated with nerve syndrome known as ectodermal dysplasia as well as genetic conditions such as cleft lip, cleft palate, and Down syndrome. Anodontia can be classified into three main categories. They are true anodontia, false anodontia, and pseudo-anodontia. In true anodontia, again it can be classified as total and partial. And partial can be again classified into two categories, that is hypodontia and oligodontia. So, anodontia means it is a congenital absence of teeth. So, and when we see the classification, we can group into three categories, that is true, false, and pseudo. In the true anodontia, again it is classified as total and partial. And in partial anodontia, there is hypodontia and oligodontia. Etiology. It can be due to hereditary factors, familial tendency, radiation injury to the developing tooth germ, hereditary ectodermal dysplasia, and mutations. So, the causes for anodontia are hereditary factors, familial tendency, radiation injury to the developing tooth germ, hereditary ectodermal dysplasia, and mutations. In the previous slide, we have seen that true anodontia can be classified into total anodontia and partial anodontia. Total anodontia involves the missing of all teeth, and in partial anodontia, it involves missing of one or more teeth. So, let's see in detail. Total anodontia. It may involve both deciduous and permanent dentition. Missing of all teeth. This is a rare condition. When it occurs, it is frequently associated with a more generalized disturbance, hereditary ectodermal dysplasia. So, in total anodontia, the main points are it involves both deciduous and permanent dentition, and here all the teeth are missing, and it is a rare condition. Usually, it is associated with hereditary ectodermal dysplasia. Then comes partial anodontia. Partial anodontia may involve missing of one or more teeth. Hypodontia is the missing of one or more teeth, and oligodontia is the missing of six or more teeth. Partial anodontia is a common condition, and it most commonly involves the tooth, third molars, maxillary lateral incisors, and maxillary and mandibular second premolars. In severe cases, there is bilateral absence of the corresponding teeth. So, in partial anodontia, the main points are it involves the missing of one or more teeth, and it can be classified into hypodontia and oligodontia. Hypodontia involves the missing of one or more teeth, and oligodontia involves missing of six or more teeth. And compared to total anodontia, it is more common, and the most common teeth involved are third molars, maxillary lateral incisors, and maxillary and mandibular second premolar. In severe cases of partial anodontia, there is bilateral absence of corresponding teeth. False anodontia. It is also called as induced anodontia. It occurs as a result of extraction of teeth that can be due to caries, periodontitis, etc. Pseudoanodontia. It is defined as clinical but not radiographic absence of teeth. It can be due to failure in the eruption. So, false anodontia is also called as induced anodontia. It occurs due to the result of an extraction of the teeth, which can be due to dental caries, periodontitis, etc. And pseudoanodontia means there is the clinical absence, but there won't be any radiographic absence of teeth. It is due to the failure of eruption in the teeth. Anodontia treatment. Prosthetic replacement of missing teeth is possible using dental implants or dentures. It can aid in chewing and can improve the appearance of the patient. So it's very simple. It's a prosthetic replacement of missing teeth using dental implants or dentures. Next comes the supernumerary teeth. Supernumerary teeth is nothing but an extra or additional teeth present in the dentition. A supernumerary teeth may closely resemble the teeth of the group to which it belongs, or it may bear little resemblance in size or shape of the teeth to which it is associated. It has been suggested that supernumerary teeth develop from a third tooth bud arising from the dental lamina near the permanent tooth bud, or possibly from the splitting of permanent tooth bud itself. Another theory for the formation of supernumeraries is that it is formed as a result of the local independent conditioned hyperactivity of the dental lamina. In some cases, there is hereditary tendency for the formation of supernumerary teeth. So, we have to remember that supernumerary teeth is nothing but an extra or additional tooth that is present in the dentition. It can either resemble the tooth of the group to which it belongs, or it can have little resemblance in size or shape of the tooth to which it is associated. It can develop from a third tooth bud arising from the dental lamina near the permanent tooth bud, or from the splitting of the permanent tooth bud itself. Another theory also suggests that it is formed as a result of the local independent conditioned hyperactivity of the dental lamina. Supernumerary teeth can occur as single or multiple, unilateral or bilateral, erupted or impacted, can be seen in one or both jaws, more often seen in permanent dentition than primary dentition. While there is no gender predilection in primary dentition, males are affected approximately twice as frequently as females in permanent dentition. Supernumerary teeth it can be seen as single or multiple, erupted or impacted. It can be seen either in one jaw or both jaws together. It can be seen both in primary dentition and permanent dentition, but it is more frequently seen in permanent dentition. There is no gender predilection in primary dentition for supernumerary teeth, but in permanent dentition, males are affected approximately twice as females. Now let's see the association of supernumerary teeth. It is mostly associated with cleft lip and palate, cleidocranial dysplasia, and Gardner's syndrome. Supernumerary teeth can be classified on the basis of morphology and location. On the basis of morphology, the supernumerary teeth can be classified into conical, tuberculate, supplemental, and odontome. In odontome, there are two types, that is complex odontome and compound odontome. Based on the location, the supernumerary teeth can be classified as mesiodense, paramolar, and distomolar. So, supernumerary teeth can be classified into two categories based on the location and morphology. On the basis of morphology, it can be classified into conical, tuberculate, supplemental, and odontome. And in odontome, there is two types, that is complex odontome and compound odontome. And next comes the based on the location, it can be classified into mesiodense, paramolar, and distomolar. Now, let's see in detail about each type of supernumerary teeth. Conical, small peg shaped, most commonly found in permanent dentition. It develops with root formation ahead of or at an equivalent stage to that of permanent incisors. It is usually present as mesiodens, occasionally found high and inverted into the palate or in horizontal position. It can result in rotation or displacement of permanent incisor, but rarely delays eruption. Conical supernumerary teeth is small and peg-shaped. It is mostly found in permanent dentition and it develops at an equivalent stage or ahead to that of the permanent incisors. It is usually present as mesiodens. Mesiodens occurs in between the two central incisors. Mostly it occurs as mesiodens, but occasionally it is found high and inverted into the palate or can be seen as horizontal position. It results in rotation or displacement of the permanent incisors, but rarely delays eruption. Tuberculate. It has more than one cusp or tubercle, frequently described as barrel-shaped and may be invaginated. Root formation is delayed compared to that of permanent incisors. They are often paired and commonly located on the palatal aspect of central incisors. They rarely erupt and frequently associated with delayed eruption of incisors. Tuberculate supernumerary teeth, its shape is barrel shaped and it can be invaginated and it has one or more cusp or tubercle. The root formation of the tuberculate supernumerary teeth is delayed compared to that of the permanent incisors. They usually occurs in pairs and can be seen on the palatal aspect of central incisors. They rarely erupt into the oral cavity and it is frequently associated with delayed eruption of incisors. So the difference between conical and tuberculate supernumerary teeth is that conical occurs as peg-shaped and tuberculate occurs as barrel-shaped. The root formation is ahead of the permanent incisors in conical, but in tuberculate, the root formation is delayed to that of the permanent incisors. Tuberculate delays the eruption of the permanent incisors, but conical rarely delays eruption of the permanent incisors. Tuberculate occurs mostly in pairs and conical occurs mostly as mesiodens. Supplemental. It refers to a duplication of teeth in the normal series and is found at the end of tooth series. Most common supplemental tooth is permanent maxillary lateral incisor, but supplemental premolars and molars also occur. The majority of supernumeraries found in the primary dentition are of supplemental type and seldom remain intact. In supplemental supernumerary teeth, we can see that it is the duplication of teeth and it is seen at the end of a tooth series. The most common supplemental tooth is permanent maxillary lateral incisors. But in some cases, supplemental premolars and molars can also be seen. The majority of these supernumeraries found in the primary dentition is of supplemental type. They seldom remain impacted. Odontome. This category of supernumerary teeth is not accepted worldwide. Odontome is derived from the term odontoma, which means tumor of odontogenic origin. Odontoma refers to a hamartomatous malformation rather than a neoplasm. The lesion is composed of more than one type of tissue and consequently has been called as composite odontoma. Two types of odontoma. The first one is complex composite odontoma. the diffuse mass of dental tissue which is totally disorganized. And the second one is compound composite odontoma, malformation which bears some superficial anatomical similarity to that of the normal tooth structure. Odontome as a category of supernumerary teeth is not accepted worldwide. It is derived from the term odontoma, which means tumor of odontogenic origin. It refers to a hamartomatous malformation rather than a neoplasm. Since it is composed of different type of tissue, it is called as composite odontoma. There is two types of odontome. They are complex composite odontoma and compound composite odontoma. In compound composite odontoma, it the structure resembles some similarity to that of the normal tooth structure. But in complex composite odontoma, the diffuse mass of the dental tissue, it is completely disorganized. So it doesn't have any similarity to that of the normal tooth structure. Till now, we have discussed the types of supernumerary teeth according to the morphology. Now, let's see the types according to the location. They are mesodens, paramolar, and distomolar. Mesodens is situated at the midline between the two central incisors. Paramolar. They are small and rudimentary and most commonly situated buccally or palatally to one of the maxillary molar, and distomolar situated distally of the third molar. Treatment for supernumerary teeth. The treatment depends on the type, position, and possible complications identified both clinically and radiographically. Surgical extraction is the most common treatment. Another option is to reposition the supernumerary teeth in the dental arch. Pre-deciduous dentition. Infants occasionally are born with structures which appear to be erupted, usually in the mandibular incisor area. These structures must be distinguished from true deciduous teeth or so-called natal teeth described by Masler, which may have erupted by the time of birth. The pre-deciduous teeth have been described as hornified epithelial structures without roots occurring on the gingiva over the crest of the ridge, which may be easily removed. They arise from accessory bud of the dental lamina ahead of the deciduous bud or from the bud of an accessory dental lamina. Usually in infants, teeth starts to erupt at 6 months of age. But some infants are born with teeth which are called as natal teeth. These are different from pre-deciduous teeth. The pre-deciduous teeth have been described as hornified epithelial structures without roots, occurring on the gingiva over the crest of the ridge, which may be easily removed. These are described as hornified since it is white in color and packed with keratin. They arise from accessory bud of dental lamina ahead of the deciduous bud or from the bud of an accessory dental lamina. Post-permanent dentition. After insertion of complete denture in older individuals, there won't be any eruption of teeth. But in some individuals, even after extraction and placement of complete denture, there will be eruption of teeth. These are the result of delayed eruption of retained or embedded teeth. These are called as post-permanent dentition. A few cases are recorded of persons who have had all the permanent teeth extracted and yet have subsequently erupted several more teeth, particularly after the insertion of full denture. Most of these are the result of delayed eruption of retained or embedded teeth. A small number of cases, however, do appear to represent example of a post-permanent or third dentition, since they probably developed from a but of the dental lamina beyond the permanent tooth germ. Today, in this lecture, we discussed about the developmental disturbances in the number of teeth. We learned about Anodontia, supernumerary teeth, pre-deciduous dentition, and post-permanent dentition. This is a small yet important topic for your board exam as well as for competitive exams. Please do subscribe to my channel and click on the bell icon so that you will be notified when I upload new videos. Thank you.